Okay, we'll get back to our original programme. Can I now start by inviting Professor Catherine Comiskey of the National Advisory Committee on Drugs and Alcohol to say a few words and officially open the conference. Thank you.
Oh, thank you very much, Bernie, and thank you for inviting me. Anybody who knows me knows I'm well able to say a few words, so if I say too many, stop me. I've been teaching for over, I dare say, how many years, so as I say, I'm well able to talk. And I suppose when you're passionate about a subject, you want to share that passion with people. And I mean, you've all taken the time here today to leave the job, to take time out of your busy schedules. Your managers have released you, and you've taken the time to come here and learn and find out what's happening. So hopefully you'll get the benefit of that. I suppose being an educator and fortunately, you know, have through 20 odd years of research, a researcher, I want our decisions based on evidence. And we can, you know, and that evidence, the hard evidence and the sort of the real life stories as well, what's it actually like. So I suppose in some ways that's what the National Advisory Committee on Drugs and Alcohol, of which I have the privilege of being the chair, is about. It's about producing the evidence. So in a I suppose, you know, we don't take sides. We say, this is it. This is the story. So that's what, I suppose, in a sense, what the NACDA is about. It's producing the evidence. So it was established in 2000 in order to advise the government in relation to drug misuse based on research findings. But I'm also a great advocate of not having the research report on the shelf. Okay, that's not what it's about. It's about taking that research and converting it into practice. My own training was originally actually in mathematics and statistics, so I'm interested in the numbers. But in my day job, I'm head of a school of nursing and midwifery. Right? So there's a shift. So really I'm about taking those numbers and putting them into practice. And we educate 1,300 students a year. It's the largest school in the country. So there's 1,300 people who are going to be nurses, midwives, mental health professionals, working across the broad range of healthcare. So I do believe passionately about the research, but how that research goes into practice, your practice. What does it mean for you? And the policy to advise the minister and his colleagues. So we're now, our remit was extended to alcohol in 2013. So we're very, very fortunate on that committee. In actual fact, people give of their time freely. We have members and representatives from the community and the voluntary sector. So there are people who are working, who are meeting people on a day-to-day basis, who are seeing what it's like on the ground. So there's more than one type of evidence. There's the scientific evidence, of which I would be, you know, I suppose, advocating, as well as then the other types of evidence from the community and voluntary sector. And it's based on all of that evidence that we should be making our decisions. It's that shared evidence. So we're very, very fortunate that we have those professionals on the committee and the health professionals. We serve at the invitation of the minister, and my appointment was a ministerial appointment, so I'm very proud of that. My mother makes great. You can imagine. Well, we all have a mother, you know. How many of us in the room are mothers? And I mean, I'm a mother of 4. So I know what it's like to have teenagers. I have 4 teenagers, well, from the age of 22 to 13. So not only am I an academic and a researcher, but I'm also a mother. So I also know what it's like to see the teenagers coming in, you know, and the pranks and all of that, all right? So I come from that aspect as well. And that's part of the evidence. I know what it feels like. So the NACDA, I told you I could talk. The NACDA have 3 subcommittees that support us in that work. We have the Early Warning and Emerging Trends subcommittee, which has been so busy with the new psychoactive substances. We have the Prevalence and Prevention Committee, which has been very busy this year, and I'll talk about that in a moment, looking at the new estimates of prevalence. What is the scale of the problem? And trying to get a handle on that. Treatment, rehabilitation and consequences. Well, obviously, you know, we can't do everything. We have done a lot of work in the past on treatment. We need, and it is in the National Drug Strategy, to look at rehabilitation and recovery, but we haven't had the resources to be able to do that. But we're hoping that that will be one of our next pieces, because we all know, you know, that it's so important to be looking at models of recovery and evaluating those. So the plan, what do we focus on, is based on the National Drug Strategy. But as you know, our minister was saying, that is a document that was written a number of years ago. So we do have to be proactive and think, well, what is the priorities within that plan given the resources? So we look at the sort of 5 epidemiological indicators from the sort of which are specified by Europe, because we are part of Europe, so we're contributing to the EMCDA, the European Monitoring Centre for Drugs and Drugs Addiction. So in terms of that action and related to the EMCDA, we have to look at prevalence and patterns of drug use among the general population and problem drug use. And we've done a lot of work in the past on that, and we have new research coming out. So this is some of the work we've done in the past, and these can all be downloaded from the NACDA website. So in terms of evidence, if you're looking for evidence, I mean, these are living reports. We have the reports on drug use in Ireland and Northern Ireland. Which gives you the sort of the top line results. These are the previous survey, which was 2010-11. We're hoping to have our current one, it's done every 3 to 4 years, come out at the end of this year. So we're just, again, putting those numbers together. What is the current prevalence of different substances in the general population? So this survey, the previous one, had 5,000 participants between the ages of 15 and 64, and the next one actually has over 7,000, because we've actually removed the age limit of 64, because as the population is aging and we have chronic substance misuse, we want to say, well, let's go beyond 64. So we've done that this time, so we have a larger sample. And the latest results of that will be coming out at the end of the year. But this is the current one that we're working from. The one that you might be interested in, actually, this is the prevalence, and this is the cannabis results. So I was just looking at some of the top line figures there from the previous survey, is that 7% of the general population of people aged between 15 and 64 have used cannabis in the last year. So 7%, that's more than 1 in 20. So if there's 60 people in this room here, there's 3 of you at least who have used cannabis in the last year, just in this room alone, right? So we're talking about people 15 to 64. So that's, well, the minister is pointing down there, but that'll tell you, that is in the general population. That's at least the numbers. That's putting the numbers in context. So when you go into the room the next time, just think one of these 20 in here, all right? So that's how widespread it is. So that's what I mean by putting numbers in perspective in terms of your practice, all right, and policy. We also have a report coming out again. These will all be late this year and early next year on the prevalence of problematic opiate use. The last estimate was related back to 2006, and the estimate was of the order of 20,000. People at the time thought it was high. I wonder what people think now. We know that it has stabilised in the city, but we also know that it's spread to the urban, from urban to rural areas, that there isn't anywhere in Ireland that doesn't have some problematic opiate use, heroin use, and we all know that. So this will give us an update so that we can have an idea of numbers in order to plan our services and our policy. Another piece we have coming out at the end of this year, so we have actually been quiet, because when you're doing the work, you're quiet. So we've been quiet this last year. And then when we have the work, you'll hear a bit more about us. So the other piece we've been doing that's going to come out is, and I think this is really important, and one of my own PhD candidates is here who's actually doing a PhD in this area, is the prevalence of children who reside with parents who use substances. We don't know how many there are. How many children? There's been the hidden harm reports of the UK. We don't have our own hidden harm report. It's that hidden numbers. How many children are living with parents who use drugs? And what is the impact of that? We don't know is the answer. Well, this report will be the first attempt to answer that. And Karen, who's in the red, is actually looking at that within one local drugs task force. She's doing a piece of research out in Tala to find out, well, how many do they have? Because they want to know how many are we going to plan for in their area. again, to inform their policy, the task force policy and strategy, and the practice of the people that they are funding, moving it into that real world domain. So the NACDA are doing that at a population level, and again, it'll be the first time that these results will be out. That was prevalence. We've also, as I say, if anybody's interested, we can share data. We also did a lot of work in the past under, very quietly sitting back there, a gentleman, former Professor Des Corrigan, who was the former chair, and his shoes were very, very big shoes to follow when I stepped into them. Professor Des Corrigan, we did look at treatment of drug use across the country. And this is, again, was done, finished in 2006, 2007. We looked at treatment. We know that treatment works. Okay, we know that treatment works. With that, we have done that work, as I say, under the direction of Professor Corrigan. It was I had I suppose the honour of doing the research at the time, and this took in over 400 opiate users who actually were polydrug users across the country. We followed up them over 3 years. We got over 90% follow-up rates. I can tell you there's nothing like that in the world. All right, in the UK, they only managed around 70%. And that was brilliant. In Ireland, thanks to service providers helping us, we dealt with over 54 agencies, services that you come from, who helped us follow up and trace and get back and find out how are these people doing in service, in treatment. And you know what? They do well. They do very well. They relapse, but they get a little bit better each time, and I'm sure you've seen that in your practice. So now we have the evidence to prove it. It's there. So if you're looking at something specific, if we mention decriminalisation and legalisation, obviously they're different, but substance treatment reduces crime. We know that. And it sustains. The reduction is sustained. Treatment works. And that's, again, from the NACDA under Professor Des Corrigan there. All of our data, we do have a data sharing policy. If you want to get data, we do have data at local level. We don't have many resources to pull it out, but it breaks my heart when I see that there's 5,000 people in a survey. We've done 3 surveys. We're on our 4th survey now. We do have data at local level. If you want to get it pulled out, you can contact us and we'll try and get the resources to pull out that data for you. It's there. You could be looking at trends in the general population in your area. That data exists. Use it. The investment has been made. Obviously, the HRB have data on treatment, but this is the data on the general population. I told you I get passionate, so don't mind me. These are just, Bernie said to me, look, can you give us some of your personal observations, what's going on? So I was actually fortunate that this week I was actually at the Joint Oireachtas Committee, sat this week, the Joint Oireachtas Committee on Justice, Defence and Equality, actually looking at decriminalisation. And it was so interesting to be there and to see the democratic process. And, you know, people, you know, we do have a voice. If you put in a submission to something like that, you can be invited to come in and speak to the Oireachtas Committee and give your opinion. All right, so we do have a voice. We need to use our voices, and it was so democratic. And what was so interesting was to see that from the hospital consultants to the network of social workers to Merchants Quay to the Association for Criminal Justice and Research and Development, myself. Such a wide range of people, all were saying we need to move towards a public health model. So in terms of let's not penalise people, they weren't talking about legalising, they were talking about the emphasis should be moving towards a public health model. Let's help these people because we know the treatment works. So that was interesting, and to see that consensus around the room, but also consensus that we do need more research on what model. And we have models on treatment, and we know treatment works. We haven't looked again at the recovery models, and we don't know what works in Ireland in terms of recovery. That research hasn't been done. Another thing that's happening is that I've been invited over to the London School of Economics, and I believe you're going, Minister. We're there. We're both on the same panel. Again, it goes to show you that this is this wider debate, that this is not just within Ireland, that we're all struggling with learning and trying to find out. But if we share that learning, I'm a firm advocate of my learning and your learning, share that learning, we'll get better, sharing, and we'll get better outcomes as a result. I also have the privilege of being one of 7 people from around Europe who is selected to serve on the scientific committee that advises the European Monitoring Centre for Drugs and Drugs Addiction. So I go there about twice or 3 times a year. And again, Professor Corrigan was on that previously and is still as an expert advisor as well. But what's happening there, these are just my own personal reflections. I was there about a month ago. An awful lot of the work is on the new psychoactive substances and risk assessments of those. Bless you. They have something that you may not be aware of that they're developing at the EMCDA, and it's online. It's what they call the Best Practice Portal. Go and look and see what's there, because they want to work on best practice. What is best practice? I know we have the practice that we do and that we're comfortable doing, that we believe works, but let's take a look and see what is there. And, email them if you think there's something missing. They're only developing the Best Practice Portal, and they really want to share that learning across Europe. A lot of talk about the infectious diseases as well, and the other aspect is the ageing. On the new EU action plan for drugs, as a scientific committee, we can give our input into that. And some aspects that I inputted on was about the need to look at chronicity. You mentioned a 12-year-old to 21. I mean, when we say chronic, we tend to think older. I do. And you're saying from 12 to 21. But I actually, when you were saying that, I was thinking, I wonder what's the story with the parent of that child. What happened with the parent, and we heard this morning about the new childcare places and everything, and I'm wondering about parenting. And, we're on our 3rd generation of substance use in families in this country, in Dublin anyway. So really I'm wondering about, chronicity isn't just about the older, also the younger, and this inheritance within families, and, what can we do to stem that? We're seeing that in terms, again, international research. I had to review a paper from Australia. I love the Australians and the Canadians and some of the American stuff from the well, there's some good stuff. There's a 33-year longitudinal outcome study, and that's what I'm talking about, chronicity, chronic substance use, that people get better but they relapse, but each time they're getting a little bit better. So I looked at some stuff from they've got an 11-year study. In Ireland we just had a 3-year study, and these people are all aging. They have an 11-year study. After 11 years, 25% were still using, but 75% weren't. Let's speak positively. 75% weren't. They'd moved on. Half were still, or just under half, were still in some form of treatment. So perhaps they might have been on a methadone. I'm not sure of the detail, but they were living their lives. They were in recovery. They were contributing to society and living their lives. And that was an 11-year study. And there's a 33-year study from the US, which have similar sort of figures. So this is, what we're dealing with. And again, because of my own passion, as I say, my own personal research interest with my PhD students, and that is in this whole idea of chronicity, aging, parents and children. So that's just my own little personal observations. How do we... I'll just move on to the next. Sorry. I told you, am I going on too long? So just to be aware that I really want to try and get the NACD work out there. We do want to look at more management of our research and getting more research out to you as practitioners and policymakers. And then finally just say, share the passion, and thank you very much.